So today we'll start with chronic suppurative otitis media. So chronic means anything which is greater than 6 months. All right? And suppurative means pus. Otitis is basically our inflammation and media is our middle ear. Okay? So if we talk what is chronic suppurative otitis media, it is basically an long-standing infection of the middle ear cleft, okay, and it has two main features, that is ear discharge and permanent perforation of the tympanic membrane. So we'll try to understand the definition. So long-standing, as you know, greater than 6 months, middle ear cleft. So this is our middle ear cleft. This has a middle ear cavity, a eustachian tube, and on the posterior side, we have our Otitis, antrum and mastoid air cells. Now, when do we call it a permanent perforation? Okay, so think this is our tympanic membrane. All right. On the outside, it is lined by squamous epithelium. Okay. And on the inside, it is lined by the mucosa which lines the entire middle ear cleft. Okay, so when we'll call it a permanent perforation, see, this is our perforation. Okay, so when this margin of the perforation, this outer squamous and the inner mucus, they will fuse together. Okay, so in this we will have both this mucosa layer and the squamous layer. So this is called as a permanent perforation. So we'll talk about the epidemiology. So we see it is more frequent in lower socioeconomic status, and both the sexes and all age groups are affected. We have two types, tubotympanic and atticoantral. So this is our middle ear cavity. Okay, so it is like a 6-sided room. Okay, so tubotympanic, it basically is in the antero-inferior region. Okay, and the perforation will be our central perforation. So it is in the antero-inferior and we'll have a central perforation. See, here there are not many structures. Okay, so it is called as a safe type. And then we have something called as atticoantral. Atticoantral is in our posterior inferior region. So from this region it goes towards our Otitis, antrum and mastoid air cells. See, the name only suggests attico and antral, from the attic towards the antral. So this is called as unsafe type. It is in the posterior superior region. Okay, so this is all about chronic suppurative otitis media. In the next part, we'll talk about tubotympanic and atticoantral.